Hi, I'm Bill Logan. Welcome to Physician News Network. There's helpful news if you're one of the millions of Americans suffering from chronic back pain. The FDA has cleared a procedure that has many patients saying goodbye to back pain without drugs, needles, or surgery. In our feature story, we'll be introducing a medical breakthrough. It's called non-surgical spinal decompression. With us during this program, we've invited an authority on the topic, Dr. Frank Liberti, founder of Spinal Aid Centers of America, and local spinal aid provider, Dr. Dave Podell, D.C., of the Waterfront Institute. Have you had multiple opinions for a back problem and are still living in pain? Do you sometimes feel when it comes to your chronic back pain, you don't know where to turn or who to trust? Find out who's a candidate for this procedure and more. Stay tuned. Physician News Network is next. Welcome back. Joining us now is Dr. Dave Podell, D.C., of the Waterfront Institute. Dr. Podell specializes in treating chronic and severe back and neck pain-related conditions, including previously failed surgery cases, multiple herniated or bulging discs, degenerative spinal arthritis, spinal stenosis, severe sciatica, and related spinal conditions using state-of-the-art spinal disc decompression techniques and therapy. He has over 25 years of experience with the most challenging cases and graduated from the prestigious National Institute for Health Sciences in Chicago. Welcome, Dr. Podell.
Bill, thanks for having me.
I know that this spinal decompression has become very popular and a lot of people are getting into it. How did you start in this?
Well, Bill, over my quarter of a century in practice, there was one particular condition that we really struggled with. We could take a spine and move it to the left, to the right. We could take a twist here, a twist there that was causing pain. But we never had the technology or ability to literally open up a disc space and take the pressure off that disc that had been beaten up over years from accidents, injuries, falls, bad posture, bad habits, etc. Just a few short years ago, we could not have really provided patients with this level of technology. So I started looking into it and doing my homework, and I was very impressed by the results. Hence, we decided to add it to our multidisciplinary clinic.
But a lot of people are into this non-surgical spinal decompression. It goes by a lot of different names. A lot of different companies are offering products in this line, if you will. What makes Spinal Aid different?
What is excellent about Spinal Aid is that it brings together a group of super dedicated doctors who share all their experiences, whether they be technical or patient education. And when we get together as a group, we are updating all our technique, our understanding of how these things work. Are there different twists or turns to using this approach that will help patients get better faster and more effectively? Right
at the beginning, we ran through this laundry list of back problems.
Mm-hmm.
Are there any particular diagnoses that respond better with this sort of protocol?
You know, Bill, almost all these conditions are sort of under one roof, if you will. A bulging disc, if left alone, becomes a herniated disc. A bulging disc can just slowly lose its fluid and become degenerated and become arthritic, or what we call degenerated or dehydrated. Stenosis is often a situation where there is multiple bulging discs and are bulging into the spinal canal itself, causing a shrinkage of the canal. So they all fall under that list. Obviously, if you have one herniated disc, it's a less severe or difficult case than, say, 3 or 4. But we do get all those cases, and most of those conditions have done very well using spinal decompression and a related therapy that we use. If we can grab a problem earlier on, treat it, decompress it, get it healthier, plump that disc full of fluid and blood and nutrients and get it to heal naturally, seal that disc so it doesn't re-herniate, that individual is going to have less problems as he goes along with time versus letting it get to 3, 4, 5 levels of disc herniation, or the type of patient that lets it get stenotic, where the canal really starts to shrink.
When a patient comes to you, obviously, in many cases, you're the last stop for them because they will begin to get better. I think studies have proven that this sort of practice, this sort of protocol does do wonderful things in most cases, but Are you getting people that are at the end of their rope and have tried everything else, or are you getting people that really want to latch on to this new technology and see if this is going to work for them first?
That's a really good question. We get both ends of the spectrum. I will get people that have been through no other therapy, but they've heard about disc decompression in our office. They're so impressed with what they heard, they do not want to end up going through all that other stuff, which might include invasive epidural injections, nucleoplasties, disc herniation surgery, fusions, etc. They don't want to let it get to that point, and those people respond very well. While those people not be in as much pain as the chronics, they understand that taking care of it now is a better idea. The chronics come in after they've been through that stuff, and they've heard that since the procedures they've tried hadn't worked, that this is what they really need to do, and those people often do very well in the main.
Doctor, suppose that a person comes in and starts going through this procedure, starts feeling better. How long can they expect that to last?
Bill, if patients follow our protocol and use our education process, if they do all the things that we instruct them to do, in the vast, and I mean the vast majority of cases, roughly 95% based on our in-office statistics, these patients are not back with relapses. Now, that doesn't mean a guy can go out and become a construction worker again when he's 75 years old. But that being said, if they follow through, if they do the protocol to the T, if they do the core strengthening, if they wear the bracelet when we tell them, if they do the exercises, if they stay away from certain really significant activities, they are in the main going to stay very well on a long-term basis.
So are you saying that a disc can essentially heal itself?
Bill, the research indicates that we can literally create a negative pressure in that disc, and when we do so, we are literally pumping fluids, blood, nutrients, vitamins, etc. into that disc to literally heal the outer bands. If we didn't get that healing process, it would be like pumping air into a flat tire, but not fixing the flat tire, and it would go flat again. So we not only have to pump up that disc and fill it with fluid to rehabilitate it, we've literally got to seal it up. And by disc decompression technology, we are able to literally create a repair job to that disc. And that's why we get the long-lasting results.
And you're not doing this with painkillers and needles and scalpels and surgery. You're doing this in almost a more natural setting.
Well, those procedures you mentioned, while occasionally necessary, do the exact opposite of what we'd like to do. They just treat the pain. When you just treat the pain, you leave the problem in there. And when you continue to get painkillers or relief with outside things like medicines and drugs and injections, you literally fool the body that it's well when it's not, and you continue to damage that disc. And those are the people that come in with really severe problems to see us, because that stuff absolutely just stops working totally.
So this really is a way to get better rather than just get used to being bad.
Well, not only will patients feel better, but they will generally stay better.
Right now, somebody may be sitting at home and watching this and saying, you know what, I would give anything to just have my old life back, to be able to go out and play some golf or go shopping with my friends or go into the city and see some shows. But wait a minute, the reality is, how much is this going to cost? So when a person comes in and makes these sort of questions, is there an answer you can give them? Is there a set price, or is this something that really you're going to have to try and figure out on a case-by-case basis?
But when a patient calls our office, the first thing we do on the phone is determine if there's any rock-solid medical reason why they cannot get the protocol. Of course, out of 40 calls that we get a week, about 10 of those people absolutely cannot have the care.
Really?
They might have an underlying medical condition, anything that might be precluded from getting on disc decompression. But if the rest of those folks that come in, we go through a very detailed history, an extensive examination, and we look at their diagnostics very closely. Then we put together a program of care. Care is so affordable. There's almost no one that cannot afford care in our office based on our flexible payment plans, patient financing. We find a way when a patient needs care to make it affordable to them.
All right, Dr. Podell, thank you very much for being here with us.
To join the ranks of thousands of Americans who have been able to experience total relief of chronic and severe low back pain, call 1-877-4-LOW-BACK.